Autism acceptance, what families and communities need to know. Hi, everybody. I'm Dr. David with another episode of Your Health, Your Choice. I am serving here today in the role of an educator and someone who has experience very much over the past 20 plus years of working with families of people who have autism and people who have autism. Now, ultimately, my goal is for people to be educated so that they can make the best decisions that they possibly can for themselves and their family. But it's important to know that there are choices that are out there, and to have the most information you can will allow people to make the best decisions that they can for themselves or their families. Now, today we're going to be focusing on a few things. We're going to be talking about some of the common indicators that have been associated with autism. We're going to talk about both the diagnosis as well as the treatment of people with autism. And we're going to be talking about with a focus on the acceptance, not just awareness and tolerance of people with autism. Okay. So as far as the state of autism today, the average diagnosis is happening around 2 years of age. This has been getting younger and younger due to both awareness as well as screening in pediatricians' offices, awareness in schools and daycares, etc. And it's very good that the levels have been coming down to a younger age of closer to 2 years of age because that allows us to intervene faster. Now, approximately 1 in 44 children are now diagnosed with autism in America. When I first became a pediatrician 25 years ago, that number was about 1 in 2,000. So, yes, there has been more awareness of it and therefore better diagnosis, but certainly it does seem as if there are more cases of autism now than there ever have been before. Now, April has historically, or at least for the past, couple of decades, been known as Autism Awareness Month. And this has recently changed to be referred to as Autism Awareness Month instead of Acceptance Month. And the reason for this is because we want to have inclusion, not just tolerance. Okay. Christopher Banks, who is the president of the Autism Society of America, has said, autism is knowing that is knowing awareness is knowing that somebody has autism. Acceptance is when you include a person with autism in your activities, help them discover and develop in that community, and get the sense of connecting with other people. So often, people with autism and their families become quite isolated, whether it's because they don't know who to turn to, sometimes it's because they're embarrassed, sometimes it's because they've been shunned by other people because of the bad behaviors that a child may have. And of course, it's not as if it's anybody's fault. This is something that, as a developmental condition, as a psychological condition, that are affecting people. So not only is it important to be aware of it, but how can we bring people more into the fold? How do we make families not feel so isolated? How can we make kids feel like they're kids? Isn't that a nice idea? Letting kids be kids. These kids go through so much therapy in the first place, but isn't it nice to be able to get them part of our community as well? Now, there are two organizations, one that I've been very involved with, one that I shared information on last month about, that are doing this very thing. I've talked about the Penguin Project, where children who are considered mentors are paired up with special needs children, including people with autism, to put on full stage musical theater productions. There's been several in the Tampa Bay area. There's actually 32 chapters in 16 states throughout the country now involved with the Penguin Project, and a link to the Penguin Project has been put in the notes below. And there's also something called buddy baseball that you may have heard of, where again, it's a very similar thing where peers are matched up with special needs children to help them around the ball field, to help them in the locker room, to help them in the dugout. And all of these are to help not just again, so that they could be there, but to be actively participating in things that children as well as adults like to do. And these organizations are working with young adults too. It's not just children. So again, you'll see a link in the show notes for Buddy Baseball. But again, how can we involve them? How do we get them as much part of our lives, and so that they can have the most fulfilled lives possible? Okay. Now, you may have heard the story before. I think I shared it once before on this channel. But I first started seeing a patient with autism during my residency at Tampa General. And this was back, I believe, in 1995. Back then, autism was considered so rare that literally when this child was admitted to the floor, not because of their autism, because the kid had a pneumonia, but we were said, hey, go there in this room here on the pediatric floor, there's a child with autism. You should go see this child, interact with this child. Who knows, maybe you won't see one again. And that was the first time that I saw a child with autism. And that was obviously kind of almost a laughable thing to think that that would maybe, who knows when I would see one again, because soon thereafter, as I started working in the developmental clinic and seeing kids more up close with them, but certainly it became a point where it was almost you couldn't go to the mall or hanging out in a public place where it wasn't obvious that there was a child with autism. So that certainly has changed, and that has certainly increased even more. Now, there has been more, as I said, more accurate diagnoses and early diagnosis due to awareness, but is there something else also going on that's making these numbers go so high? Because the strain that we have on our system, our educational system, our medical system is very taxing to have all of these. So we'll talk a little bit about maybe there's ways of preventing or lowering the incidence of autism and help bend that healthcare curve so that we're not again overwhelmed in terms of the financial cost to our society. Okay. Now, I'm going to talk a little bit about some of the common indicators in people who have autism. Now, autism itself is such a varied condition. There are children who have no speech, no eye contact, who are completely in another world. And there are kids who are very high functioning, people who are very high functioning, fully able to communicate. Maybe they don't get body language so well, or maybe they're not so adept at how they are in a spatial situation. There are people who make perfect eye contact, and you wouldn't know that they necessarily had autism. And then some kids who would never make eye contact with really anybody, sometimes even with their parents. Many people with autism do have delayed speech and or communication skills. Now, sometimes communication skills does not necessarily have to be verbal skills. Again, it could be understanding of body language. It could be what they're hearing, some of their thought processes, etc. Um, and so, also it's super important to identify biomedical issues, which we're going to get into a little more, which is really what my specialty is all about. Now, in fact, let's talk about that right now. So there are a few things that actually I want to come back a little bit because there are a few other common symptoms that I skipped ahead in my notes here. Sorry about that. A lot of people with autism are very reliant on rules and on routines. If they have to maintain a certain routine, otherwise they can either get upset or flustered or anxious. And a break in their routine can really can be quite upsetting to them. Difficulty transitioning. If a family who has to make a stop somewhere unexpected or run into a store, that can really upset somebody if they're not used to that type of routine and they're expecting their routine. They can be upset, but just even relatively minor changes, just changes in their regular day, can make something difficult for them. Pardon me. I have one of my patients with autism that it's interesting. If she hears the word food or sees a food in a picture, that can upset her. She's fine with eating food. She's fine with being around food, seeing food on a table there, but just in her mind, just hearing the word, she calls it the F word. That alone could be enough that would upset somebody. Something, again, a relatively minor thing for most people. They may have unexpected reactions to sounds, to tastes, to touches, sight, smells, all of the senses, a lot of sensory processing issues. And also, they may have difficulty understanding people's emotions, why somebody may be upset with something. That's again, that's just part of that nonverbal communication and understanding. Okay, so now I'd like to talk about 5 important things for people to understand about autism and how we treat them. First, most important thing is early identification. Intervening improves outcomes the sooner that they can be identified. One of the things that every pediatric provider should be doing in their practice is something called an MChat. This is a screening tool that starts at 18 months of age, it's through 30 months of age, and it asks some very basic questions of the parents that can tip the provider onto the likelihood. It's not a diagnostic skill; it's a screen. But if there are so many questions answered in a certain way, then that should prompt a further evaluation into a much more deeper evaluation, usually done by psychologists, done by developmental pediatricians, sometimes by neurologists as well, to really get an understanding, not just is the diagnosis there, which is certainly important when it comes to educational placement in the classrooms or other types of therapeutic settings, but also in terms of funding. There is a lot of funding out there for people who have autism in order to help with their therapies as well as their education. And so understanding about the McKay scholarships and the Garner scholarships, but if a person doesn't have a diagnosis, then they can't tap into that. And certainly education and therapies can get super super duper expensive. And so it is nice to know that there are governmental and private funding that's out there to help families along the way. Okay. Now, from a biomedical perspective, which again, this is what I do most. And autism for me has always been the canary in the coal mine. When we found abnormalities in their health, in their biology, in their chemistry, it doesn't seem to be specific to people with autism. I find this with people who have depression and anxiety and ADD, the other kinds of mood disorders. I find this in people who have autoimmune conditions, hyperinflammatory conditions, allergies. I said that twice, didn't I? I certainly did. So these abnormalities can cause all different types of biological conditions that can be impactful on somebody's life. But almost all of the stuff that I've done was first found in autism. Okay, so the first thing that I always look at is optimizing what we call the gut brain connection. Okay, so yes, of course, the food that we eat, for some people can set off behaviors, right? For some people, it's of course the nutrition. And if there's a child who's a picky eater or who's not absorbing their nutrition very well, they could be starving their brain from to very, very important nutrients that we need to optimally function. So, in addition to that, we want to make sure that people have good levels of the flora. You've heard us talk about the microbiome, where we actually a healthy person has 10 times more healthy bacteria living in their gut than they do have cells of their own body. So yes, we are walking around, majority of our cells, strong majority of our cells are bacteria, not human in origin. Kind of a mind-blowing fact, but yeah, and these bacteria certainly are smaller. So in terms of the sheer amount, if you were to weigh it out, we weigh more as a human than we do as a bacteria. But in terms of the actual cells themselves, there's more inside of us than are us, which is again pretty interesting. Now, how can we, some people do not even get good flora from the very beginning because they may be born by C-section. And so they don't go through the vaginal canal, which is where the bacteria first starts to populate. Or the mom had to take antibiotics and didn't give the opportunity because it wasn't necessarily there in the vaginal flora itself. Or babies who go to the ICU who start taking antibiotics may wipe out that bacteria that was passed along through the birth canal as well. And when there is not a good, robust, wide variety of bacteria in the gut, that can cause all kinds of problems. It affects the way we absorb our food. It can allow things to grow in our gut, such as candida yeast, clostridia, and other bacteria that themselves can both inflame the gut. You may have heard of what we call leaky gut, which is increased intestinal permeability. But also, certain yeast and bacteria can secrete substances, toxins that themselves can have a negative impact on our brains and our immune systems as well. When I come across that, I talk a lot about the use of fermented foods, not just yogurts, kefirs, kombuchas, sauerkrauts, pickles, the more variety, because all of these foods have different types of flora, different types of bacteria in them. So really, and there was a point, and I still do recommend probiotics for people who aren't getting good levels from their foods or if they took an antibiotic. But probiotics themselves can be very helpful as well, although I don't use it as much in my practice now as I used to now that I'm using more and more cultured foods. But let's face it, those foods that I mentioned, there's certainly some kids, whether they are on the autism spectrum or not, who aren't going to touch those foods because obviously they're a discerning taste to a lot of these foods. But one way or another, we want to make sure that there's as much of the good bacteria in our gut as possible and as little of the bad of anything bad that shouldn't be there. Okay. Of course, our intestines are how we absorb certain very important nutrients, things like iron, things like vitamin D, zinc, things that we've talked about on this channel before. But of course, with the exception of vitamin D and through the sun, which of course, worrying about the risk of skin cancer from sunburns. But of course, those nutrients have to get into our body, and mostly that happens from the gut. Okay. Now, another thing that I found very helpful in terms of my evaluation and trying to optimize the health of a person with autism is looking at what we call the mitochondria. Now, the mitochondria are the power plants of all of our cells. If you remember from biology, the primary thing that it makes is called ATP energy. And it's not the energy that makes you hyper, it's the energy that makes us tick. Every cell of our body, we require energy every single moment of the day. There are two nutrients that are intimately involved in the function of our mitochondria. One is called carnitine. One is called CoQ10, which also has other function as well. But if those are low, and these are things that we can test through regular standard laboratories, commercial laboratories, easily supplemented and corrected. But some people even have more advanced issues, and there is a test that we do called a mitoswab. There is biopsying that people can do with skin or muscle that can look to see if the enzymes themselves are problematic, or sometimes there are genetic conditions that lead to mitochondrial issues. Some people can have mitochondrial issues that are impacting them all the time. Some people may just have mitochondrial problems when their bodies are put under specific stressors. So again, testing for, treating for, very helpful. Another thing that we find helpful in the treatment for people with autism is looking at genes, but not just any genes. Yes, there are tests out there that look for genetic potential. How likely am I to have a child with autism? But there is not an autism gene. And the reason why I don't do a lot of those types of genetic tests is it doesn't tell you what to do. And I like to do a test that will change around an outcome somebody. Now, granted, if somebody says to me, hey, I need to know whether I have an autism gene because I have a child with autism, I honestly don't know if we can go through this again. And if there is something genetic that is a dominant trait that is going to pass along to any one of my children, then maybe I would reconsider having another child. And I've had that conversation with people as well. But of course, it's not as if, if there's no genetic abnormality that is one of the genes associated with autism, of course, it doesn't mean that you won't have a child with autism either. So again, not a reason why I get those types of tests. But the tests that I do like to get are tests that look at the genes that are responsible for coding for enzymes that affect how we absorb nutrients. And this has a lot to do with B vitamin metabolism, how we absorb nutrients, how we turn them on once they get inside the body, how we transport them through the bloodstream, and how we even get them into the cells. And there are different enzymes associated with each of those. These are some of the things that I talked about in our episode with Dr. Ben Lynch, and we can go back and see that in much more detail there as well. But in the long and the short of it, if your body, for instance, can't activate folate using an enzyme called MTHFR, take activated folate. If your body cannot activate vitamin B12, take vitamin B12. So in other words, in the most simplest fashion, if your body can't take A and turn it into B, don't take the A, take the B. Okay, sounds simple. A lot of times it is, but sometimes people have a lot of these mutations, and there's a lot of work to be done. And of course, we like to introduce things one at a time, so it can take a while before we can actually get built up on all of these things that a patient may need. Now, also, there are certain nutraceuticals that can be very helpful in controlling the symptoms. So, a lot of the things that I was talking about before, we're looking for root cause issues. What are the underlying things that can be causing a problem? Now, there also are what are the treatments that can help control symptoms? And of course, there are pharmaceuticals out there, medications that are in the antipsychotic class. Not that a child with autism has a psychosis, but they're treated things like risperidol, things like Abilify. And of course, a lot of kids on the spectrum have ADHD, and some respond very well to medications like Ritalin and Adderall. And of course, there are some kids who have seizure disorders, and of course, that can be very helpful to treat with them as well. And some kids may need anti-inflammatory agents, medicines, at all. I am well versed in doing all of those things, and I spell holistic with a W because I look at the whole picture and the individual, and whatever is best for that person is what we want to do, which could be the exact opposite from another person. But also, it really comes into account what a family's belief system is. I have some families who never ever would want to put a pharmaceutical agent into their kid's body. I have some who say, I really wouldn't unless there's no other options. Or I have others who say, I usually wouldn't, but you know what? You sound like you know what you're talking about here. I've heard from other people that this works. I like to. And other parents will be like, you know what? Let's just do it all. Let's do whatever we need to do. We're up for games. And again, that's part of my relationship on a one-to-one basis with families in order to try to get understand them and help them explain what these different options are. I'll put the different options on the table for them. We can look at it this direction. We can try this. We can try this. If this doesn't work, we can go back to that. So again, spending time with families. The average appointment that I spend with the patient is 1 hour each time. Sometimes they're 30 minutes, sometimes they're 75 minutes, but about an hour, because if you don't spend the time with people, you can't explain it to them, you can't offer their choices, you can't get good feedback, you can't get good questions. So, doctors who are seeing patients in and out for 15 minutes wouldn't be able to do this type of deeper dive that we're able to do. Okay, now some of the things are that we do on a regular basis. Medical cannabis. I'm actually going to be recording shortly an episode just on this alone on an Ask Dr. David that someone asked me to speak a little bit more about that, so I'm not going to go much into that here. Magnesium, incredible calming agent, can help with sleep, can help with behaviors. A lot of our patients have constipation issues, can help with that as well. Certain amino acids. Now, yes, many amino acids are needed to help proteins grow, or actually the building blocks of proteins. But there are some amino acids that's not their primary job. Things like L-theanine, which is derived from green tea, wonderful at boosting serotonin levels. Taurine, which is used both in liver detoxification and stabilizing nerve membranes. GABA, an inhibitory amino acid, it works. The GABA receptor is how medications like Valium and Xanax and Ativan work. So sometimes those could be very helpful in helping calm kids down. And also anti-inflammatory agents. I mentioned steroids before, which is something that we have to sometimes do on a short-term basis. But of course, we don't want to have people on long-term anti-inflammatory medications. I have kids who can respond very well to ibuprofen, but we know that the chances of gastritis or the chances of ulcers are up with there. So we're looking for anti-inflammatory agents that can be taken long term. Things like high dose omega-3 fatty acids, things like curcumin, the active ingredient that's in turmeric, and you need to take an activated form, otherwise it doesn't absorb well. Um, things like quercetin, glutathione, antioxidants. Oxidative stress causes damage on the cellular level. Anti-inflammation, antioxidants can all help with those things. And so those are a lot of the things when I do an evaluation on a child with autism, those are the things that I'm really trying to focus on. Now, another thing that people wanted to know about is, and this is kind of like the other deeper part of my story, can autism be prevented? Very controversial question. And in my opinion, in my 20 plus years of clinical experience, I wouldn't say that it can be prevented. However, one of the things that developed, so this goes back about 20 years ago. When families with children with autism, we started showing recovery, these kids were getting better, and families would say, hey, we never thought we would be able to have another child because this has been so stressful, so much use of our resources, but things are better. We like to try to have another child. Are there any things that we could be doing? Maybe these biomedical abnormalities that we found in our child, maybe we have those issues too. Can we test for them? Can we treat for them before we conceive? Which was one of the more brilliant recommendations or suggestions that I've ever heard from a parent, because I was like, well, that makes perfect sense. And why not? Why couldn't we try that? We certainly can. I know how to treat teenagers with the dosing. So an adult, a young adult, a middle-aged adult, it's going to be the same thing. Weird thing was, and the grandparents started asking if I could take care of them for their stuff as well, but that I won't go there right now. But so we started running these same tests, and we started finding that a lot of times, if we cross out the names and ages of the children and the parents, we almost couldn't tell them apart. Now, we do spend a lot more time working on the mom. Of course, mom is the incubator. And dad just, of course, just contributes one cell, but it's a pretty darn important cell there. Obviously, the genetic code, how the body's able to transcribe the genetic code, unwrap it, methylation, histones, all of those are all involved in the proper the use of the genetic code that's in that one sperm cell. So that's super important as well. So we started doing this, and we started having some very interesting outcomes. Now, the chances of a family having a second child with autism, if there's one already, is about 1 in 7. Now, we are approximately 1 in 500 in our practice. So it's not stopping it, but that's a almost 10-fold, pardon me, almost 100-fold reduction in the number of cases of autism that we are seeing on a regular basis. And again, 1 in 500 total. I don't think we've had any children who, again, were born into our practice after we did this. I don't recall any that a second child that went on to develop autism. But again, relative to the 1 in 44, that is the number that we know of now. Obviously, we are doing something quite different. Now, is it because we do a lot of things to promote vaginal birth and avoid C-sections as much as possible, and we give the mom's vaginal flora through something called vaginal seeding? If there is a C-section being done, whether it is the fact that they're long-term breastfeeding, whether it is that we're getting the moms with their vitamin D and zinc levels, whether it is that we're testing babies for their vitamin D and zinc levels and iron levels by the time they're 1 and treating them, I don't know. That's a lot of variables. It would make it very, very difficult to put a controlled study together for that, because what am I going to tell? For you, we're just going to fix your vitamin D level. We're going to leave everything else the same. Of course, we're not going to do that. I am a clinician. I am not a researcher. If somebody could help me figure out a way to research all of this would be wonderful. I'm not holding my breath because I think it's too complicated. Plus, everybody's genetics are different. Plus, everybody's situation is different. But nonetheless, something that has been very helpful to us. And now that I've been doing this for a while, it's just been rather remarkable. And there is when I hear a child with autism is doing better, Obviously, isn't that like the most sweetest thing that you could possibly hear of? A family who's able to send their kid to school, a family who doesn't have to keep one child away from the other because they're afraid that the child with autism is going to hurt their other child or themselves, especially as they become larger teenagers, etc. When you see a family who has a newborn and you watch that baby grow, and a lot of them are my patients as well, and they're developing normally, and they're going to preschool, and they're going to school, and seeing and knowing what a family went through the first time, and to be able to see a family gifted with a developing child that is doing the things that they're supposed to do, and again, there's no there's no greater blessing than that. It really, it warms your heart. It's just amazing. Probably a good movie there or at some point, right? Okay. So now there are some lessons that I've personally learned working so close with people and families who are affected by autism. One of them, which I had alluded to a while ago, the uniqueness of everyone. I have never seen, even amongst twins, I have never seen two children with autism that are the exact same. Asthma, there's mild asthma, there's moderate or severe asthma. They kind of respond the same way. But autism, it is so different, like the stars in the sky. And these children are stars, and we just need to recognize that they are, and their uniqueness, the brightness that they have. Um, the Another thing is acknowledging that it's not just the child, the individual with autism who's impacted, but it's the family that's impacted emotionally. What it's like to deal with if your kid's is up all night and not able to sleep. If your child is smearing feces on the wall, if your child is attacking you, if watching your child not have friends, not be able to participate in things, in activities that you would have only hoped that your child would participate in, as well as financially, as I alluded to before, the financial burden on these families. I mean, I have families who have to do second mortgages on their homes, sell their homes, get takeout loans, borrow from family members. It's a tremendous impact on them, and that can be just so incredibly challenging. Another really important thing that I've learned: listen to the parents. Okay. I realize so often physicians have preconceived notions going in as to what they want to do. I have found that to be not so helpful. Parents, they know their kids. And so when I talk so often to and every family who comes in the first time, I explain that I don't look at myself as having a superior to inferior relationship with you because I am the doctor and I have these two initials after my name. I look at us as peers, as teachers to each other, as teammates. Okay, we have different skill sets. I know a lot about this stuff, but you know a lot about your kid. Those are two different skill sets. But I ultimately want to defer to the parent. I tell every parent that if there's something that they hear about, they read about, dream about, divine intervention, if they think it's going to help their child, even if it seems a little kooky or off the beaten path, but it hits them hard, put it on the table. I want to hear about it. Some of the best breakthroughs I have ever had has been something that a parent has brought. And it brings to mind a particular story of this young, well, now she's now younger, she's now a young adult, of one of the earlier girls with autism that I had seen. So this is again about 18, 19 years ago, maybe a little more actually. And this was a family who um, actually, I'm going to tell you a different story. So let me come off of that one because this, I think, there was this mom of a boy around the same time who came to me one day and said, you know, you told me this, but I had a dream twice that my child would benefit from vitamin B2. To tell you the God's honest truth, I don't even know what that stuff is. I just see it on the cereal boxes, but it came to me in a dream. You'd let me know about this. Now, at the time, we had one of our tests called the urine organic acid test, and it actually has some vitamin B2 deficiency markers on it. And there were no markers that were elevated, but I knew it was a B vitamin. The kid would pee it out if they didn't need it. So I'm like, okay, well, let's give it a try. Turned out to be the best thing that I ever did for that child. So there's that. And actually, I am going to come back and tell that other story because the other story is quite a heartwarming story. Because this was a mom who was so convinced that I was going to help her. She had this tremendous faith in me. I was losing faith in my ability to help this child. A couple years had gone by, and we really made no benefit with her. And she's like, "Nope, I know you're gonna get this figured out for my kid. I have faith in you." And like, well, talk about pressure being put on you. And so I went to a conference, and one of the treatments that you've heard me talk about is glutathione, a very important antioxidant detoxifier. And this child had markers that had shown that she was low in glutathione. And at this conference that I went to, they said that there are children who only respond if you give it injected via IV. Like, man, I'm going to inject kids. That's not really what I want to be doing. I'm an outpatient doctor. We don't really do that type of thing. But I'm like, it was very impressive, some of the case studies that they reported. So I came back and talked to the mom, called her up and said, hey, I don't know if this is anything, but they told me this. And she's like, yeah, I told you you're going to figure this out. I'm coming over to do it. And so she does. And I get a phone call 2 days later. I'm seeing all these great things happening. I want to come back tomorrow and do it again. And I said, well, let's wait 2 weeks. That's what I was told, how often it should be done, because you want to see how long. I'd like to know how long it's going to last. What's it going to do? So they make an appointment. They come in. I didn't even realize that they were in the office at the time. And I think I may have even shared the story once or twice. But if you haven't heard it, that my IV infusion is at the time. Patrick comes in, knocks on the door, says, David, Katrina's here. She wants to tell you something. And I'm like, what is Katrina going to tell me? I've known Katrina for a few years now, and I've never heard her utter a word. And he looks me in the eye and says, shut up. This girl's got to tell you something. And he opens the door. Katrina's there, and as God is my witness, Katrina says, hi, Dr. David. I'm feeling a lot better now. Thanks. If I never helped another child in my career after that moment, it was a fulfilling career. The mom is there. She's bawling. I'm bawling. Patrick's bawling. The girl's happy. And the kid just, that was her magical potion. That was it. Doesn't mean it's going to be for everybody, but that was for her. So anyways, I'm glad I told you that second story if you hadn't heard of it before, because it really is just, this is a heartwarming story. Okay, so there you go. Remember, we are looking to accept and work and love families and children, young adults, old adults, people who have autism. So if you've enjoyed this show, please, if you haven't already, subscribe to this channel, hit the notification button so that you can be notified whenever we publish something. And of course, if you can, please join us on our Patreon page if you want to be a patron, supporting what it is that we do on this channel so we can continue to bring this type of programming to you. All of this information, please see our Patreon information down below as well. Thanks, and have a great day.